Sometimes the most debilitating health problems are ones that you can't outwardly see. And back pain is certainly one of them. So, here to talk about it is ABC 15 Health Insider, Dr. Shad Marvasti. Good morning.
Good morning.
Boy, this is something I can relate to. I have had lower back pain my whole life, but it's also something that you see a lot in your office.
Absolutely. Actually, around 4 out of 5 people will have low back pain at some point in their life. That's how common it is. People age over 30 have, low back pain more commonly. Weight can play an issue. If you're have a more sedentary lifestyle, you're not exercising as much, you're not active. Obviously, most of us have work in front of the screen. That happened even more so with the pandemic, right? So all of that contributes to low back pain because we weaken our core muscles and our back muscles.
So, what are some more alarming signs to be watching for?
The red flag signs to watch out for is if you have shooting pain that is also accompanied by numbness, as well as weakness in the muscles in terms of the strength of your legs or your feet. If you can't walk on your tiptoes or on your heels, and then if you have any loss of bowel or bladder control, all of these could be signs of more serious disc herniation, where your disc is basically inflamed and pushing into your spinal cord, and that can be something that's dangerous. So those are some of the red flag symptoms. And thankfully, in a regular doctor's exam, we can actually tell the difference between whether or not your low back pain is strain, which is most likely the case, or something more serious within about, I would say, less than 5 minutes of an exam. It's that quick. You don't need an X-ray. You don't need an MRI. If you have the red flag symptoms and if the exam shows anything that's positive or concerning, that's when we would order something, further like an MRI or X-ray.
Of course, there are doctors who will prescribe medications if you're very severely injured, but also it's really easy to get hooked on those medications. So trying to find alternative means is always a great idea. And so what are some of those?
Yeah, so look at medication as a crutch, right? You're going to give some anti-inflammatory like ibuprofen potentially, maybe the muscle relaxant, but those aren't really the real cure of this, right? The cure is really the back exercises. So physical therapy exercises, which you can do yourself at home, not only to treat. So it's counterintuitive. You think, oh, I have a back, pain and I should just lie down. I should take it easy, but actually that'll make it worse. So actually walking and doing the exercises is treatment. Another thing that's been shown to be very effective is actually acupuncture. Can also help in addition to physical therapy, and certain forms of chiropractic can also help as well.
And some of those things can be preventative as well, so that maybe you don't get the back pain to begin with.
If you do those low back exercises, those physical therapy, low back stretches, if you do those religiously every day for about just 5 to 7 minutes, once or twice a day, you won't get low back pain again.
There you go. That's the key for a lot of people who are going to continue to stay remote, that's their new lifestyle. So that really can make a huge difference because, man, if you've had any back pain, it is one of the worst.
Oh, yeah. I've experienced it.
World.
Yeah. So, other kind of tips is, don't sit for longer than 40 minutes at a time without getting up and doing some stretches, walking around for a few minutes, and then just doing those targeted stretches that really strengthen the back muscles.
It really can be so easy. And that's what we want to do, is make this easy for people. So we appreciate your time and your guidance this morning.
Absolutely. My pleasure. Thank you.